Hi, my name is Dr. Sanjeev Nayak. I am an Interventional Neuroradiologist at the Royal Stoke University Hospital in the United Kingdom. The pandemic of coronavirus or COVID-19 represents an unprecedented challenge to our healthcare system. For successful care of COVID-19 patients, it's important to address the effective safety and prevention strategies relating to the healthcare workers. I'm going to address some of the challenges of COVID-19 relating to stroke, thrombectomy, and stroke care. Patients with a history of acute ischemic stroke and its relating risk factors are particularly at risk for severe form of COVID-19. There is early evidence that COVID-19 can cause neurological signs such as encephalitis or stroke-like symptoms, and this has been reported in the brains of patients and animal models. Just like SARS virus, COVID-19 is associated with hypercoagulation and can lead to secondary strokes. Some of the pulmonary failures can also be secondary to pulmonary embolism. In settings of stroke, the neurointerventionalist should be well versed what to expect when dealing with a COVID-19 patient. Firstly, you should have the appropriate personal protective equipment or PPE as per your institutional protocol. You should, the things like it's a surgical cap, eye protection, gowns, gloves, shoe cover, etc. in particular emphasis to the N95 mask. When a patient comes to the hospital, the COVID-19 results will not be available, especially in a setting of acute stroke. So all potential patients should be screened for fever and for pulmonary symptoms or respiratory symptoms. In our institution, especially for thrombectomy patients, we perform a CT head, a plain CT head followed by a CT chest in all these patients first, because if you do a contrast exam such as a CT angiogram, this will mess up the findings. Particularly contrast messes up the subtle pulmonary findings that you see in COVID and can give a false positive result. So please perform a CT head and a CT chest first, and this will also help you to decide whether you should use the PPE or not. If somebody with a CT chest negative and no features of COVID, it will save you from using this kind of equipment, especially in this time of pandemic where this PPE is well in scarce. Once you decide to proceed to thrombectomy, I personally prefer to perform this under local anesthetic, because patients with COVID have got a 25% risk of mortality when performed under general anesthetic. Preferably local anesthetic is far more better for this kind of patients. And once this procedure is performed in the angiographic suite, please try not to extubate them within the angiographic suite because of the risk of while extubation of infection by airborne contamination and also by contact contamination. So try to take them in a secure room within ITU to extubate these patients. Following this procedure, we deep clean the angiographic suite so that the suite is ready for the next patient. So this is the brief standard care we take while dealing with COVID patients in acute stroke setting. So finally, thank you, and be safe and take care of yourself.